Welcome to this video series on wellness program resources. Our topic for this video is health management interventions for employee wellness programs. And we're going to be dealing with the question of what are some effective health management interventions that can be used in an employee wellness program. Number 56. Over more than 4 decades of professional work, I've been fortunate to work with literally hundreds and hundreds of employer wellness programs. And I would say the vast majority of them have really not understood what kinds of health management interventions they could use to improve the health of their employees and their family members. And that perception has been so broad and so deep that I really got used to encountering people that had very little understanding of what could happen with a wellness program. They really had a particular model of wellness in their minds and did not do much to really change that or challenge that. So I found myself frequently challenging them and helping them really address the problem of having a wellness program that would not necessarily improve the health of their employees. And that's going to be a non-starter for most senior managers. So what I ended up doing was developing a tool that actually laid out a whole variety, and then we would work on being able to see which ones fit best with the goals of that particular employer and could be explained to senior management and could be funded and actually implemented. And I would challenge them to actually carry through on this and work with specific interventions. The company that I and some colleague friends developed was really intended to give that ability to dial up or dial down the amount of health management intervention an employer could use with a given workforce. Now, what we're going to do next is I'm going to share with you the issues around the fact that there are lots of possible health management interventions. We're going to look at many that can be used in an employee wellness program. And that can change the whole context for how wellness is looked at and how management looks at wellness programming. So we're going to be looking at that tool next. Now, what you see on the screen next to me is the issue of a tool that is really designed to provide you with basic ideas about how you can expand your wellness program to actually manage health and to affect the health and health improvement of your population. There are more than 60 categories that are listed in this 6-page tool. You can stop the video, by the way, go to the link that is in the description for this video, and then download the tool, and then print it off, and then follow with me as I cover some of the highlights. Now, the categories you'll see at the top are the problem or issue that is involved in that particular area. So that's that first column on the tool. The second column is the description of the suggested screen. And what that means is this is the way in which you might structure the health risk assessment question in order to trigger and identify the individual who could benefit from the health management intervention around that specific problem, issue, or pattern in behavior. Then the third column are the suggested intervention. And those 60 plus interventions for the 60 plus problems, issues, or patterns are what this particular instrument, this particular tool has in it. Now, these 3 columns allow you to quickly see what the primary issues are that you're addressing, and then what the screen would need to be in the health risk assessment and or the biometric screening or preventive screening that the individual would need to go through in order to gain the information to enable you to do the health management intervention, which is over here. So if you, what we're going to do, by the way, is you'll just be looking at the first page, and then I will be going through and identifying the range of additional topics that you might include in this kind of approach to integrating health management interventions into your employee wellness program. Now, and then we're going to go through some key questions that you might ask, and then also into some areas of additional tips about how you might use this tool. So as we see on the first page, and as you can go down the list here, it's health is excellent, and then the screen would be a Likert questions structure that would have strongly disagree. So we have the Likert scale approach, which allows us to strongly agree, neutral, disagree, and strongly disagree. And when they marked strongly disagree to the question about is their health excellent, then that would identify them as a potential health management intervention, or someone that an intervention could be done with. And then the suggested intervention in this particular case is to contact the individual to discuss the basis for their poor health, determine what additional interventions may be useful and appropriate. So that would be the opening for a wellness coach to talk with the individual about that. And that example on our first item would be followed through on all of these areas, the 60 plus areas that are in the tool. And that includes expect health to get worse. That comes from the RAND health insurance study results. The perception of their health, the seem to get sick easier than others. That again comes from what's called the RAND health insurance experiment science base. And then depression, the issue of diabetes, the issue of stroke, the issue of cancer, and the issue of chronic back pain. So again, this is just the first page. Now I'm going to essentially go through the rest of these to give you just a highlight of what some of these items include. The next area, pregnancy, readiness to change, smoker, life problems, and their perception about those life problems and the severity of those. We've got lots of people with lots of life problems in our workforce. Stress reduction, use of a medical self-care text or a medical self-care software program or website. High sick leave use, obesity, allergies, cholesterol levels, the presence of heart disease or heart disease symptoms or diagnoses, hypertension, arthritic conditions or rheumatism, asthma, migraines, sciatica, a nerve problem in terms of usually a hip or leg, lifting techniques not used, the cumulative trauma disorder, the occupational exposure to a number of risk factors or behaviors, and then planning to get pregnant, life satisfaction, low life satisfaction. Next page is the history of family breast cancer, kidney disease, lupus, angina or chest pain, achiness or sore joints, indigestion or difficulty swallowing, persistent cough or hoarseness. And these, by the way, are all pretty common medical questions that are included in health risk assessments. Restricted physical activity, shortness of breath, ulcer or gastrointestinal bleeding, unexplained dizziness, women's preventive screening activities. The next page has physical exam, no physical exam within a period of time appropriate to their age and gender, vision, digital rectal exam, stool blood test, glaucoma screening, regular dental checkup, flu shot, monthly testicular self-exam, monthly breast self-exam, physical activity levels. So that brings us into the fitness and activity area. Daily servings of fruits and vegetables, daily servings of high fiber foods, daily servings of high fat foods, alcohol use, seatbelt use, average driving speed, job satisfaction, social support, primary care physician status, low self-efficacy. So there are more than 60 different potential health management topics. Virtually almost all HRAs only address about roughly 8 of those items or 10 of those items. So this has the potential to expand considerably what issues you can help people with. And obviously, if you find people are not interested in working on it, then you move past them. But there's a lot of people out there in every workforce that know they have a problem and will in fact work with you to help change that over time. But we oftentimes don't do that. Our physicians are not doing that. The specialists are not doing that. The generalists, family medicine docs, primary care practitioners are not doing it. So you have an opportunity to integrate that into your employee wellness program. Now, here's some key questions for you. Does your senior management really want to improve the health status of your employees? If so, what specific behavioral or health targets are they interested in improving? Second question is senior management interested in funding the proposed activity and using an outside vendor to carry it out? It's not going to be carried out usually by the inside wellness people. It's going to be people outside that are on a vendor and have a clear firewall of information between the vendor and the employees of the organization. And then the next question is, can you review the options with your executive team in a meaningful way? Can you speak to some of these things? Can you lay out a sequence of health management activities and metrics that will help you and them evaluate the effectiveness of your approach? You want to be able to determine how much health improvement has actually taken place during a year of programming. And finally, how much training will your staff or vendors need to do a good job on the health management problems and issues you plan on addressing? Now, a few additional tips. This approach is usually used as part of a results-driven approach to wellness. That's a more serious approach than simply what we call the feel-good or traditional wellness approach. And it usually is a more serious endeavor where the employer really wants to see some improvement in the health of their employees, not just a perfunctory or a tactical kind of program that puts on a few activities here and there. And the next issue that I would suggest is you need to be willing to use an RFP, a request for proposal, to find the right vendor to be able to do the kind of intervention that we're talking about here. And finally, these health management interventions work best when combined with a compelling and meaningful incentive. When we do that, we tend to get a lot more people being willing to work on a specific health management issue. In summary, the use of selected health management interventions is a great way to significantly increase the effectiveness and the results from your employee wellness program. Ideally, you should be able to dial up or dial down the amount of health management results you are able to realize with your own workforce. Thanks for watching this particular video, and be sure to subscribe to my YouTube channel. New videos are published weekly. Well, for more information, you can search for WellCert on the web. WellCert is the premier professional certification for employee wellness programs. Be sure to check out this training program if you want to improve your wellness programming skills. And remember, delivering great employee wellness programming is a high calling. Let's do our best to get the job done. Good luck.